The numbers are staggering. New data has revealed more than 400,000 people in Toronto are now without a family doctor, and almost a quarter of them lost their family doctors in just 2 years alone. With more family physicians now retiring and fewer medical students choosing family medicine, doctors are painting a grim picture of what's to come.
I'm extremely surprised and quite terrified.
The data released earlier this week has family physicians on edge. The number of people without a family doctor in Toronto has ballooned to 415,000. That went up by 72,000 people between March 2020 and March 2022. And at least 385 doctors are now urgently needed in Toronto. Across Ontario, 2.2 million people are without a doctor. That's up from 1.8 million in 2020.
We live in a universal healthcare system. Part of that means a doctor. The people who have their hands on the levers need to care more about the people that are losing their doctors.
Really, it is quite staggering. We do know we're just not going to find enough family doctors to fill that void that we're seeing.
The most vulnerable communities in the city are being disproportionately impacted, with more than 120,000 people with low incomes now without a family doctor.
What's really worrisome is that these are often our most vulnerable patients who really need access to a family doctor.
The disparities are most pronounced in the city's West End, north of the city core, and in Scarborough.
The areas that were affected have highly racialized populations.
If we can bring doctors in that suit that represent the population that's also coming in, you're also going to deal with things like equity and equality, especially within healthcare.
The Ford government has committed to streamlining licensing for internationally trained physicians and opening up more family medicine residency training spots in the province, but it doesn't seem medical students are interested even in the existing spots. 286 residency positions remain unfilled across Canada this year, the highest number on record according to new data. And Ontario had the highest number of vacancies with 100 family medicine spots unfilled. That, coupled with more retirements, has become a recipe for disaster.
The status quo is just not enough.
We also know that our population is aging and patients are presenting with more complex medical issues, which ultimately requires more of our time as family doctors.
We're told expanding team-based care is an effective way of addressing the challenges family physicians are facing and will enable family doctors to take on more patients and see them faster.
And that would be a family physician working with other allied health professionals like nurses, social workers, dietitians.
Only 25% of family doctors in Ontario currently have access to this kind of team support. We're also told doctors are spending far too much time on administrative tasks, and alleviating that burden could free up 19 hours a week for the average family doctor. For City News, I'm Tina Yazdani.